We will discuss the components of a gluten-free diet. This diet is essential for individuals with celiac disease or gluten sensitivity. A gluten-free diet involves avoiding specific grains like wheat, rye, and barley. These grains contain gluten, a protein that can trigger harmful reactions in people with these conditions. Adopting this diet requires significant changes because gluten is present in many common foods. It is crucial to understand which foods are safe and which should be avoided. Key points on a gluten-free diet. Avoid wheat, rye, and barley. These grains are the main sources of gluten and should be completely excluded from the diet. This includes products made from these grains like bread pasta and cereals. Safe alternatives. Grains and flours that do not contain gluten include rice, corn, buckwheat, and potatoes. Flours made from soy or tapioca are also safe. These can be safely consumed and used in place of gluten-containing grains. Reading labels. It is important to carefully read food labels, especially on processed foods and condiments. Some additives like stabilizers or emulsifiers might contain hidden gluten. Alcoholic beverages. Distilled spirits such as vodka or whiskey and wine are gluten-free. However, most beers, ales, lagers, and malt vinegars should be avoided since they are typically made from gluten-containing grains. That said, gluten-free beers are now available in many places. Dairy products. Initially, dairy products might cause discomfort due to lactose intolerance. This is common in people with newly diagnosed celiac disease. If dairy seems to worsen symptoms, it might be best to avoid it at first. Oats and celiac disease. Oats are a bit tricky. While oats themselves do not naturally contain gluten, they can be contaminated with gluten during processing. Studies show that pure, uncontaminated oats are generally safe for most people with celiac disease. This is true when consumed in moderation, less than 40 to 60 grams per day. However, it is still recommended to introduce oats gradually and monitor for any symptoms or test results that suggest a reaction. Conclusion: living gluten-free can be challenging. However, with the right information and careful food choices, it is manageable. Resources like dietary counseling and written guides are very helpful in making this lifestyle change easier. Ongoing research helps us better understand which foods are safe, including the evolving guidance on oats. Regular monitoring and communication with your healthcare provider can help ensure that your gluten-free diet is both effective and healthy.